Hello, I'm Barb Winters. Welcome to Port Huron Hospital's Today's Health. You know, sports injuries happen, and sometimes they can cause lifelong problems. So it's really important to get them evaluated and treated carefully. Joining us to give us information on treatment is orthopedic surgeon Dr. Leonard Karadimas. Dr. Karadimas, welcome back to Today's Health.
Thanks, Barb.
What are some of the most common sports-related injuries?
The vast majority of sports-related injuries involve the knee and shoulder, but certainly we do see some injuries that involve hips, ankles, wrists.
Well, I know there's lots of things that can go wrong in these areas, so we're going to focus on the knee and on the shoulder.
Perfect.
On this program. So starting with the knee, the anatomy. I know you brought a model.
I did. It's right here. The basic anatomy is you have a femur, which is the top bone, connected to the tibia, and the two articulate, giving you your knee joint. There is a small bone in the front, the kneecap or the patella, and you have a variety of ligaments, which are these structures that hold these two bones together. The inside medial collateral ligament, outside lateral collateral ligament, stop the knee from going too far one way or the other. And then you have two central ligaments, the cruciates, that stop the knee from going too far forward or backward. And of course you have cartilage in the knee, two kinds of cartilage, Barb. You have the white, smooth, in this particular model it's blue, but the white, smooth, shiny cartilage at the end of the bone, like the end of a chicken bone, articular cartilage. And then you have these menisci, these crescent-shaped cushions that sit around the edge of the tibia.
As I'm looking at that, I'm thinking, wow, there's just got to be a lot of things that can go wrong when you have sports-related injuries. What are the most common ones?
Typically, you're going to injure the ligaments or the cartilage, the things that sort of hold the knee together, and the cartilage cushion, just because the impact of the knee, either a twisting force or a straight rotational force.
So those are the things that, but can you break your knee?
So certainly you can fracture the knee. It takes a fair amount of force to break the bone, more force than it would to tear a ligament or a cartilage area. That's why that's more common.
And especially in sports-related injuries.
Correct, correct.
Are there injuries that are related to age, like younger people get these kinds of injuries, older people get these kind of injuries?
There are. You certainly will see a little bit increased amounts of torn ligaments, cruciate ligaments in the younger population. Especially females. You do see some related growth plate fractures in the more younger population. When we're young, we have open growth plates. That's where the area, that's where the bone is actually growing longitudinally, lengthwise, and we reach a certain age that closes off. And you do see a little bit more anterior or patellar type symptoms, tendonitis, in young athletes.
Are there special things that you need to do to treat the younger athlete? Are there special considerations? You talked about the growth plate. Is that a concern?
It is a concern. Mainly that concern arises when we're thinking about doing some type of surgery and avoiding injury to that growth plate. And perhaps even sometimes when we deal with cartilage tears in a younger population, there may be a little bit more blood supply or possibility for those to heal. But a lot of these things are actually treated very similarly.
If I'm injured playing sports, what's the first thing I can do before I even get to you?
Yeah, typically it's going to be your standard stuff, rest it, ice it, elevate it, maybe take an over-the-counter anti-inflammatory, and see how things go from there.
Are most sports-related injuries obvious so people know, wow, I better get to the doctor, or do sometimes people kind of wait around and do their own thing? I
think it's a little bit of both in my personal practice. I mean, I certainly see people that injure themselves and wait for a longer period of time than they probably should have, and then folks that injure themselves and get in right away. Typically what I tell folks is if you have an injury, get some rest, ice it, elevate it, and if it's not better in a few days, that's probably a good reason to seek attention.
Is it pain that usually brings most people in the quickest?
It is pain. I mean, you certainly see people come in because they have a swollen knee or bruising, or difficulty sleeping at night because of a variety of reasons. But most people are going to be are going to come in secondary to pain.
What's the spectrum of treatment options for these injuries?
Well, it can, obviously it's based on your actual injury and the problem, but it can range from oral anti-inflammatories like Motrin, Advil, Aleve, physical therapy, steroid injections into the area of concern, all the way to surgery.
Well, I want to talk to you more about some specific injuries, but first we're going to take a break.
All right.